whole body too, even your feet.
Yeah, we need tablecloths. That's what we need to make sure we have next time.
Yeah, no, you have to, yeah. I expected a few more people though.
Yeah, I think they'll be joining Zoom stuff.
No, could have done it for Zoom too.
Hello, world. I'm Wallace Allen. I publish West Side Story newspaper here in the Inland Empire. Welcome to tonight's program. It's being presented to us by the California Association of African American Superintendents and Administrators from their Educational Equity and Advocacy program. It's personal. The truth about COVID-19 vaccine. This is a town hall event featuring descendants of the United States Public Health Service syphilis study at Tuskegee. We're broadcasting live on San Bernardino Unified School District's YouTube. Once again, we have guests tonight from the Tuskegee study. We have Mrs. Lily Tyson Head and Mr. Eric Patterson. Eric's grandfather, Mr. Dahl Brown, was a study victim and descendant. Eric is the grandson. Mrs. Lily Tyson Head is the president of Voices for Our Father's Legacy Foundation. She is the daughter of Freddie Lee Tyson. He also is a victim of the United States Public Health Service's syphilis study. Regarding that study, in 1932, the United States Public Health Services, working with the Tuskegee Institute, began a study to record the natural history of syphilis. It was originally called the Tuskegee Study of Untreated Syphilis in the Negro Male, now referred to as the United States Public Health Service's Syphilis Study at Tuskegee. The study initially involved 600 black men, 399 with syphilis, 201 who did not have the disease. Participants' informed consent was not collected. Researchers told the men that they were being treated for bad blood, a local term used to describe several ailments, including syphilis, anemia, and fatigue. In exchange for taking part in the study, the men were promised free medical exams, free meals, and burial insurance. By 1943, penicillin was the treatment of choice for syphilis and becoming widely available, but the participants in the study were not offered treatment. In 1972, an Associated Press story about the study was published. As a result, the Assistant Secretary for Health and Scientific Affairs appointed an ad hoc advisory panel to review the study. The advisory panel concluded that the study was ethically unjustified and that the results were disproportionately meager compared with known risk to the human subjects involved. In October 1972, the panel advised stopping the study. In March 1973, the panel also advised the Secretary of the Department of Health, Education, and Welfare, now known as the Department of Health and Human Services, to instruct the United States Public Health Services to provide all necessary medical care for the survivors of the study. Later in 1973, a class action suit was filed on behalf of the study participants and their families, resulting in a $10 million out-of-court settlement in 1974. The Tuskegee Health Benefit Program was established to provide these services. In 1975, participants' wives, widows, and children were added to the program. In 1995, the program was expanded to include health as well as medical benefits. The last study participant died in January 2004. The last widow receiving THBP benefits died in January 2009. Participants' children, 10 at present, continue to receive medical and health benefits. On May 16, 1997, President Bill Clinton issued a formal presidential apology for the study. Dr. Rodriguez, Dr. Sandra Rodriguez, she is one of our panelists. She is also the Assistant Superintendent of Student Services here at San Bernardino in the San Bernardino School District. Our other panelist, Dr. Joshua Beckley. He's a Senior Pastor at Ecclesia Christian Fellowship. And Brenda Ross, Dr. Brenda Ross. She's Assistant Professor, Maternal and Fetal Medicine at UC Riverside. I'd like to start by asking Dr. Rodriguez to make her opening statement and welcome us to the school.
Thank you so much, Mr. Allen. It is an honor to be here today in the presence of yourself and others who are really taking a proactive stance in order to mitigate the equity issues that we have in our city and in our county. As we know, in our community, people of color struggle with continuing their education as well as access to health care. And organizations like yours, the California Association of African American Superintendents and Administrators, are really in this journey to provide more information so that people can make informed decisions about themselves and their families. And for us, on behalf of the superintendent, Mr. Doc Irwin, we want to thank you for being here today. We want to thank the people in the audience who were with us live, as well as those people who are online. It matters what happens in our community. Our people need to feel safe. They need to feel healthy. And as we go through this journey of COVID-19, and many families have suffered loss due to this virus, it's important that we're well informed about what we need to do to keep ourselves safe. So again, I want to thank you all for being here. I want to thank you for tuning in. And again, it's important for all of us to be informed so that we can make decisions that are going to be best for ourselves and for our families. Ultimately, we want to make sure that we have a community of educated individuals who believe that they can make a difference. And I think your presence here today shows that. Thank you.
Thank you, Dr. Rodriguez. We would like to ask our guest from way out of town, Ms. Hurd.
Good evening.
Tyson Head, I'd like for you to explain why you're here and tell us a little bit about your program, Voices for Our Father's Legacy Foundation. And then you, Mr. Patterson, I'd like for you to follow up with her. And
Testing. It's on. Good evening. My name is Lily Tyson Head, as you have heard from Mr. Allen. And I am joining you here tonight from Wirtz, Virginia, and Franklin County, the birthplace of Booker T. Washington, who was enslaved there until he was 9 years old. It is my pleasure and privilege to be here on behalf of Voices for Our Father's Legacy Foundation to encourage all of us to take the vaccine and to believe in the medicine and the science of the vaccine. This is and will be the best way that we can move forward to getting back to normalcy, as well as protecting ourselves and the health of others. I'd like to thank, before I go into my presentation, I'd like to thank Dr. Rodriguez, Dr. Ross, and for being on the panel here tonight with you. It's a pleasure and it's also an honor. I would also like to thank Mr. Dwight Bond for inviting me to come here tonight, along with my fellow descendant, Eric Patterson. And an overwhelming thank to Mr. Michael Dennis for his transporting us from place to place. Thank you. I appreciate you all. You have heard some of the history from Mr. Wallace, and I would like to add a bit more to that from a personal point of view, as well as correcting some information about the study. The heinous and infamous United States Public Health Service syphilis study of untreated syphilis in the Negro male took place in Tuskegee and Macon County, Alabama, from 1932 to 1972. 623 men, and I would like to add a note that I have seen a record where there are 625. A lot of you have seen the 600 number floating around, and that is inaccurate. There were 625 names that are documented on papers at the CDC, and we don't want to leave any of those men unaccounted for. The men were deceived into believing that they were going to be treated for their bad blood, which was a cover term for a variety of illnesses, including diabetes, malaria, syphilis, among others. They were promised, as you have heard, free meals when they would go to be treated, transportation to the center, and that they would be treated. But they were not treated, nor were they given the consent to be a part of a study where they would not be treated. For 40 years, the men were treated like lab guinea pigs. Even when penicillin became available in 1943, they were denied the treatment. And for 40 years, they were denied the treatment unless they decided to pursue medical attention somewhere else and found it favorable. Some of the men were placed on the non-acceptance list for the United States Armed Services during World War II in Macon County. I have not seen documentation where they were denied in other places, but in Macon County, they were denied there. Reason being, if they went to the service, they would receive treatment. The men's names were also placed on a list of non-treatment that followed them after they left Alabama. This I know for a fact because my father's name was on the list that our family doctor had in Connecticut after he left Alabama. So it did happen. The men were to be followed, and the goal of the study was for the men to be followed until their death. And that was for the autopsies of their bodies. If their families agreed to for them to have an autopsy upon their death, they were given $50 to help with the burial insurance. And they would find or send the specimens then to be tested and treated. At this point in time, and this day, we do not know what the results were. And that's one of the things that the foundation is looking into, finding out what happened. It was believed at this time that the Negro male was somehow less than their white, I wouldn't, well, I should call him brother, but there was less than the white male, and that the syphilis would affect the Negro male cardiovascular system and not his neurological system, because they didn't feel that it would affect their brain. They were looked upon with disrespect, lack of dignity, and as well as being a bit subhuman. And this had this was pretty much the way it was felt during slavery time. The study was revealed in 1972, 50 years ago this year, by Jean Heller, a young AP reporter who was told about the study by Peter Buxton, who happened to come upon the study while he was researching another project. Once the study was revealed, it became commonly known as and called the Tuskegee Syphilis Study, or the Tuskegee Experiment, when in fact it should have been the United States Public Health Service Syphilis Study at Tuskegee and Macon County, Alabama. By putting Tuskegee in front indicates that Tuskegee was the owner, accountable for, and responsible for this study, and they were not. Yes, Tuskegee provided a place, and they also provided doctors and nurses to help with the study, but they were not the owners, and it's questionable as to how much they really knew about the end goal. The ownership, responsibility of this study and the accountability belongs to the United States Public Health Service Syphilis Study, and that's what it should be called. In this era of racial reckoning, it is vital that a fact-based education on the historical experience of African American people in this country be paramount in order for us to forgive, heal, and trust. As the pandemic continues to loom over our daily lives, and as we search for new ways to adjust to the new normal, we must first regard and respect medical science and medical interventions. In addition to accepting medical breakthroughs, we can all do our parts by getting fully vaccinated. The United States Public Health Service study is the longest unethical and immoral study in the history of biomedical research and public health. The Public Health Service study's history profoundly affects attitudes towards trusting the validity of vaccines and causes suspicion. And it causes doubt when we are faced with serious illnesses and a worldwide pandemic. This study should definitely not be used as reasons for not getting vaccinated. And it has been used and it has been talked about. And that's one of the reasons why I'm here representing the Descendants and the Foundation to encourage everyone not to make a comparison, but to see and realize the contrast. There is no comparison. The men were denied the antibiotic penicillin when it became available. Here today, we have the opportunity to get vaccinated. And if we deny ourselves of the vaccination, we will be doing the same as the government had done to those men. So we shouldn't do that. There is too much misinformation about the Public Health Service study, which is one reason that it is referred to as the reason for hesitation. The most damaging and confusing is the belief that the men were injected with the bacteria that causes syphilis. They were not. Of these 623 men, 423 of them were in the syphilitic group. They had latent syphilis. 200 of the men were in the control group, and they did not have syphilis. My father, Freddie Lee Tyson, one of the men in the study, had latent syphilis. After researching records at the CDC, or his records at the CDC, we found that he had, and documented that he had congenital syphilis, something that he had inherited from his mother. We found that he was so ashamed and traumatized because he had found out that he was in the study. And it was unimaginable to think at the time how anyone could do that to our father, someone who was so beloved and the rock of our family. He and my mother, Johnny, were very meticulous about their health and about their physical being. And then to learn when he was in his 60s that he had been a part of such a study. My father also was a very wise and forgiving man. 3 days or so after he found out definitely that he was in the study, I asked him how did he feel about knowing that he was in that study, and how did he feel about knowing that he was used in that way. And my father said, "Baby, I can't do anything about what has happened to me and all of those other men, but it's up to all of you to make sure it doesn't happen again." Another reason, and the main reason why I'm here. I would like to acknowledge my mother and all of the wives who were a part of those men's lives and their significant others, because they too were subjected to the cruelty and the immorality. And when I speak of my father, I also bring in the memory and reflect on the men who were in the study, some of whom I knew personally, and some, in fact, even another, there were 2 others who were related to me, a great uncle and a couple of cousins. The foundation is dedicated to building trust in the healthcare system by addressing healthcare disparities and racial and social injustices. The foundation is a nonprofit organization, and it was formed in 2014 at Tuskegee University's National Center for Bioethics in Research and Healthcare. Our reason for joining was to change or transform the legacy that was left by the study. Out of all of the scholastic and medical reports and research, all of the writings refer to the clinical side of the study and not to the humanitarian side, the men's humanities. It was time for this to change as we learned more, read more about what was being written, what was being said. The mission of this organization is to honor and preserve the legacies and histories of the men who sacrificed and suffered inhumanly, and to promote education, public health, and research. To begin with this accomplishment, the stories of the men and their families must be revealed in a decidedly comprehensive and compelling manner, both visually and technically. Thus far, we have been able, in our short 8 years, will be 9 years existence, we have begun to tell their story. We have honored them with awarding scholarships to Descendants every year, encouraging Descendants to consider a career or profession in healthcare. We also have participated annually in the commemoration of the presidential apology at Tuskegee. And we have reached out to many Descendants, hopefully to encourage them to become a part of our mission, to help in advocating for better health care, as well as telling the factual story about the men. I am indeed grateful for the opportunity to be here tonight, and I hope each of you will continue to remember, and if you haven't, to remember the men, because from that study, things came about that were not there before. The Belmont report that was started, or it came about in 1974, after the study was revealed, to examine this very study and to see how it could be improved. From that study, different commissions also came forth. And most importantly, and we all are benefiting from that today, every time we go for a medical procedure, we have to sign a consent form. There was a consent form on the books, and it was placed there or adopted in 1927. But when it came to the men, it was completely ignored, and it was very seldom practiced. So we now know that we have the consent form, and it was strengthened because of that study, which is good. It was also strengthened because of the revealing of the misuse of the Henrietta Lacks cells. So those two things came together, which really compounded a lot of changes in the way things are done. We've come a long way in medical care for those marginalized people, but we have so far to go in addressing disparities in healthcare. I ask you to join, or not to join, but to kindly view the Voices for Our Fathers website. It's voicesforfathers.org to find more information about us, what we're doing, and what we hope to do. And again, I'd like to thank all of you who are here tonight and all of you who are watching. Thank you, and have a wonderful evening.
Lily Tyson Heard. Ms. Lily Tyson Head, thank you very much. I can see from the atrocities of that study why many people are hesitant about trusting the government or trusting the vaccination. Eric, would you like to add to?
Yes, sir. Firstly, I'd like to introduce myself. My name is Eric Patterson. I'm a native of Tuskegee, Alabama. I graduated from Booker T. Washington High School. I live in Georgia now, Warner Robins. And Ms. Head, she touched on a lot of key points, but I would just like to add, I'm always asked to compare the Tuskegee syphilis study to the COVID-19 virus, and everybody want to know why is the African American community skeptical about the booster and the vaccination. Well, firstly, you can't compare the Tuskegee syphilis study to COVID-19 because, like Ms. Head said, you had 623 African American men that were studied for a long period of time and not treated for the disease. And when penicillin was available, they were still denied the disease. So essentially, they never knew about it. Whereas with COVID-19, it's not just a problem in small rural town Tuskegee, Alabama. It's a problem here in San Bernardino, California, and it's an international problem. But we have a solution. We have the boosters, and we have also the vaccinations, the vaccines that are available with companies like Johnson & Johnson, Pfizer, and Moderna. And just like Ms. Head said, to not want to take the vaccine would be doing your family a disjustice, yourself a disjustice, and your community, because it has been proven that the vaccine and the booster save lives. So, and when we talk about, like they also asked me, why are we skeptical in our community? And you have to think about it. The African American community has been very vulnerable since we first got here in Jamestown, Virginia in 1619, coming up through slavery, the Civil War, Reconstruction, and the whole Jim Crow separate but equal era. And in our community, it's kind of hard to trust because of two variables. And if you don't get anything else out of this, I want you to remember this. The first variable is historical mistreatment. The African Americans have been oppressed. And the second one is systemic racism. And still today, and I know in the southern states, qualified African Americans that have been through school and they work hard are still denied jobs at different agencies, federal jobs, and also working in the private sector. And also, they are denied housing for different reasons, a lot of made-up reasons in some affluent neighborhoods in the South. So, and I think in order to improve the relationship in the African American community and to improve the relationship in all over the United States, we're going to have to do a few things. And that is, firstly, we need local leaders to work with the local, state, and federal government agencies like the Center of Disease Control and Prevention, the Public Health Services, and also work with private organizations like Johnson & Johnson, Pfizer, and Moderna to improve a couple of areas in the different communities, and especially the disadvantaged communities. And these areas are, Ms. Head, she touched on it as well. Education. I know even before COVID-19 came about, still we had African American communities that didn't have enough teachers and did not have enough resources to work effectively and efficiently. And also in healthcare, in small rural towns in the South and also in urban areas, healthcare in some areas are pretty much non-existent. And the criminal justice system, we have a lot of problems there that need to be fixed. And also, like I said, employment opportunities. So essentially, I think in order for African Americans to begin to trust and to begin to believe in the government and other private organizations, we need to work together and start fixing some of these problems. And that's all I have.
Thank you very much, Eric.
Thank you.
As we've discussed the hesitancy, the reason for some hesitancy, I'd like to ask Dr. Brenda Ross to speak and tell us why she's here and maybe speak to some of the issues of hesitancy.
Good evening, everyone. As was previously stated, I'm honored to be here. I'm honored to be among such distinguished guests. As a physician, growing up in the 70s, I had heard about the Tuskegee experiment a lot, whether it was in elementary school through high school, college, and medical school. And it was always just something that I read about and knew from a distance, but to actually be in the presence of people who are descendants from people who were actually affected by the study, I feel very honored, and I wish to honor the memory of your family members. For me, it's personal for a variety of reasons. I'm an obstetrician gynecologist. I grew up here in Inglewood, went to Howard for medical school, stayed there for residency, and came back and practiced medicine at Cedars for a while, and then went to Hopkins. While at Hopkins, I served as the director of the HIV and pregnancy program at Johns Hopkins, serving women who were in inner city Baltimore. And so the HIV infection rate was really high at that time, not something that we've dealt with a lot here in Southern California. And so to work with young Black women who were infected via a variety of different ways, and to talk to them about the importance of staying on their antiretrovirals and reducing the risk of having children who were born positive was hugely rewarding for me. And now I find myself in the center of this pandemic, another disease that is decimating my community. And I think that it is our responsibility for those of us who have been well educated from a variety of different angles and come from a variety of different disciplines to make it clear that this is a real issue. It's personal for me because my mother died last year from COVID after having been infected by my younger sister whose family was living at home with my mom, as so often happens in our community. I want to be angry with my sister. Of course, my sister and her family didn't infect my mother purposefully, and my mother knew what she was getting herself into when she left my house and moved back to Tatum, Texas. Talk about small rural communities. And she fought hard to live. She was 80 years old, reasonably healthy, fiercely intelligent, and absolutely my role model, my very best friend in the world. But she fought hard, and it was a hard fight. It was a very hard fight. And so if I don't do it for any other reason, I have to honor my mother's memory by saying, had the vaccine been available, she would be here today. When she died, the vaccine wasn't available. So it's tantamount, it's of paramount importance, it's absolutely necessary that when you choose to not be vaccinated, that you recognize the consequences of that. And it's just not personal for you, it affects your home, your family, your community. And it's okay to not want to be vaccinated as long as you understand the implications. And I think that a lot of people don't get vaccinated simply because they're afraid. And it's okay to be afraid. And that's where education comes in, and it's okay to, to kind of be shy about being afraid, but at least be honest about it. Go to your physician or more senior family member or somebody in the community and say, hey, I'm just scared. I mean, how do I know that what this is doing and what it's not doing? When I was in Baltimore treating women who were HIV infected, many of them were afraid, and they would look at me, with tears in their eyes, and they would say, well, why me? How did this happen to me? What did I do? Why do I deserve this? And I didn't have answers for them, but I could tell them without a doubt that I could reduce the risk of their baby being born positive from 30% to less than 1% if we worked together and they took their medication regularly. And that was huge. The time that I was in Baltimore was after AIDS had sort of blossomed, so to speak, so it wasn't necessarily the community scourge that it had been. Many of the women that I worked with were women who were born positive, women who were infected by their partners, or women who had a personal history of IV drug abuse, but they hadn't signed up for AIDS. And then there were people who were just making poor life choices. And so knowing what you're doing and deciding to live in that lifestyle is okay, but you can do things to salvage your health, your mental health, your physical health. You can make a difference. And that's the thing with the COVID vaccine. So that's why I'm here. So the patients that I currently work with at UC Riverside, I have a huge number of women who opt to not get vaccinated. And, a couple of my patients have been hospitalized during their pregnancy because they opted to not be vaccinated and then got COVID and required hospitalization. Fortunately, none of them died, but one of the other things that I was seeing was that for women of color, they were more likely to show up in the emergency room late. So, people who have access to care and are not ashamed of their illness and, feel like they are entitled to be treated, show up to health care saying, look, I'm here, I'm entitled to this. You guys need to work on me, you guys need to fix this. But people who are of color, they show up, they've been sick at home for weeks, then finally it gets worse, and they come into the emergency room by ambulance. One woman was intubated in the emergency room, and she was pregnant with twins because she stayed home too late. We almost lost her, but fortunately we didn't. We were able to, she ended up going down to UC San Diego and was hospitalized there for a long time. But there are a variety of different reasons why it hits communities of color so much more fiercely than it does other communities. So late access to care, mistrust of the healthcare establishment, and those are things that we can educate around. So we can do something about that. So that's why I'm here.
Thank you, Dr. Ross. You deal with the physical ailments. Our friend Dr. Joshua Beckley, and I call him doctor because he can spiritually make you well, and he's done it for me several times. Pastor Beckley, spiritually, how do you deal with members of your church? Open up and introduce yourself, and let's get your opening statement. And when you finish, I'm going to start asking some specific questions, and I'll start with you.
Well, thank you, Mr. Moderator. It's good to be here. And again, it's an honor to be on this panel with these esteemed panelists. And as I was listening to Mrs. Head and Mr. Patterson talk about the syphilis study, I kept thinking to myself, that's a town hall by itself. And I had a bunch of questions I needed to ask and wanted to ask and can keep this conversation going. But I'm here because from a spiritual aspect, I believe the church has always been a place where our people were able to get information and be informed about what was going on in our community. And also the church often advocated and also encouraged our people to do things that were needed and necessary to uplift themselves and to protect themselves and provide for themselves. And one of the things I understand from a biblical perspective, our people perish for lack of knowledge, the Bible says. And one of the things I intended to do as this pandemic began to ravage havoc through our community was to provide a platform of information and keeping in touch with the current information through CDC and our health department, as well as 15, 20 years ago, Ecclesia formed a health ministry with the health professionals in our church. Our nurses and our doctors all work, and they've been working in our church for 20 years to keep our folks educated on the health disparities that we face as a people, and providing information, providing workshops, providing knowledge, encouraging men to get their prostate checked, encouraging things about high blood pressure and diabetes. We've been doing that for years. And so with our health ministry, we relied on them to keep us informed and posted on our website on a regular basis information to our congregation and to our community about what they can do to protect themselves and to do what they needed to do during the time when this pandemic hit in order to keep themselves from being infected. So I'm here today because I am really concerned about the infection rate as well as the low vaccine rate that is in our community. I serve in the Dade Street Del Rosa community here in the San Bernardino County, and it is one of the areas that has the lowest vaccine rate in our county. And our church during the pandemic became a testing site. And then when the vaccine came out, our church became a vaccination site, trying to provide information and access for our people to get what they needed to, or in order to protect themselves, as well as in order to make sure that they got access to the vaccine and the medicine they needed in order to ensure that this disease would not harm or hurt them and even cause them to die. So we have sought to be on the cutting edge of letting our folks know, not only just with our church, but with the network of churches that I'm a part of, with the San Bernardino Pastors United, as well as the Inland Empire Concerned African American Churches, as well as with the annual Pastors Breakfast, which is a network of about 500 churches. We try to keep our people informed and keep our pastors well informed. And we not only just speak about it in terms of workshops and in terms of online from our pulpits, wanting to make sure that our people have the information, and also have the access that they need in order to make sure that they can protect themselves and their families from this virus. I will talk more about some other things, but I know you have some questions you want to ask us, so I'm going to yield to you, Mr. Moderator, so you can ask us those questions.
Very good. The first question I'd like to ask is, have you resumed indoor services, or did they ever stop? And if you have started indoor services, what type of precautions are you taking?
Well, we did stop on ask the second part first. In March of 2020, based on the state's and the health department's requirements, we stopped live services. And we stopped live services for over a year and a half. We stopped and we went online. Prior to the pandemic, we had begun an online morning devotional on YouTube for 15, 20 minutes every morning for 5 days a week, where our congregation would meet me and we share and we encourage each other in the day. So when the pandemic hit, we had been 2 years into that, so we went online every day, 7 days a week. And what we did during those 7 days a week was not only just had spiritual encouragement, but was informing to our people about what was happening with the virus, what was going on, what the latest statistics were, where the testing sites were. We worked with the health department to become a testing site in order that our people would be informed, and we kept them aware, we kept them encouraged, and we kept reminding them that our concern for them was that they would be safe. Now, I understand that in our religious community, there was a split. Some churches didn't close. Some churches remain open. Some churches had the prospect of thinking that they were going to do this by faith and not close and trust God. And a lot of those churches had a lot of outbreaks and a lot of people get infected. We felt for our community and for the sake of our folks, we needed to create an environment where they felt safe. And a lot of our folks wasn't coming to church in the first place. When they heard about this thing and they said not coming, they stopped coming, period. And so we provided an atmosphere for them where they could still experience church. We went online, we did our online services like we did, and we did, like I said, it was on 7 days a week. We reopened just Father's Day in 2021. That was we started our live service back again, and that was not an individual decision. That was a corporate decision that we made with 30 other churches in the San Bernardino area, all African American, because we wanted to be on the same page, and we wanted to send the same message to all of our people that when we opened up, we were all opening up because we wanted to know that we wanted to provide an environment that was safe and that we were not going to do this in competition with one another. And we've been open since Father's Day. And when we opened in Father's Day, the precautions we set in place, our church has chairs, it doesn't have pews. So we set it a COVID environment. We divided all of our, put everything 6 feet apart, groups of 3, 4, and 2 chairs, and all of those aisles, front and back, are 6 feet apart. We had our health ministry out in front. They were taking temperatures. They were providing masks. They were providing sanitizers for people to wash their hands. We encouraged people to wear their mask while on campus, and if they were on encountering anybody that was not their family, they needed to make sure they had their mask on. When even in the worship services, we allowed them to take their mask off as long as they were sitting in a group with their families, but when they got up and walked around the sanctuary, they had to put their mask on. We've been open since June 20th, Father's Day in June. And during that time, with those precautions, we can say, I was just talking to our executive staff this morning, there has been not one person who has said that they have been affected by coming to church. Not one in the whole time we've been open since 2021, because of our precautions and because of the things that we've been doing in terms of keeping our folks safe. And our attendance on Sunday has been growing because of the word getting out about how safe our environment is.
Congratulations. I say that because I'm a member of a Baptist church, and I know that we don't all say amen at the same time. So I congratulate you on being able to start back up and the congregation cooperating with that. Do you have any sense of the percentage of your congregation that has been vaccinated?
I was just talking to my health people this morning in our executive meeting about that, and they don't. But what we've decided to do is figure out a way to do a survey in our congregation and find out how many folks. I am fully vaccinated, both with my booster. I did that for the sake of being a witness and example to my congregation. All of my staff is vaccinated and fully boosted. We made sure that we remind our people that we do that, but that's something we want to find out. We know what the percentage is in our community of folks that are not vaccinated, but not necessarily in our church.
Can you share that information?
I think the last report was that in the particular San Bernardino area, 39% of the folks in our area were vaccinated.
County of San Bernardino, it's
or the Date Street, Del Rosa community area, yeah.
okay. So that's very low. So
Yes,
we're
it
talking
is.
once again about the strength of this hesitancy.
Yes.
Has the pandemic personally impacted your congregation?
Yes, it has. We've lost quite a few members, and members have lost quite a few loved ones.
What is your basic message? I think we heard it, but your message to your membership as you see them individually and as a congregation on the COVID and the vaccine?
Throughout this whole thing, I've been reminding people that the Bible says, all knowledge and understanding comes from God. All knowledge and understanding comes from God. Everything that's beneficial, everything that will help us, everything that will make life better for us, whether it comes from health professionals, politicians, wherever it may come from, where it comes from, that knowledge comes from, that's beneficial and help us live well, it's from God. And as a result of that, we need to heed that knowledge, pay attention to that knowledge, and apply that knowledge. I've told my congregation we operate in wisdom and we operate in faith. Wisdom that we get from the doctors and the CDC telling us what we should do. Faith that we put it into practice to make sure that the results of it happens in our lives. And when the vaccine came out, I reminded them God has provided an answer to our prayers. And the answer to our prayers is the vaccine. There's a story in Numbers that says Israel was plagued by serpents, and that was going into the camp and biting them, and they were dying. and they began to pray to God and ask for deliverance. And God told Moses to create a serpent, image of a serpent, put it on a pole and hold it up. And everybody who was bit by a snake, when they looked at the pole, they were healed. I said, God took the vaccine, and it's our serpent on the pole. If we would take the vaccine, it won't kill us. Even though we may get it, it won't kill us. It'll save our lives. My parents, 89 and 92 years old, got fully vaccinated and were boosted. They got COVID in January. Symptoms were only my mother felt tired and my dad had a headache. They're past COVID. They're still alive because they were vaccinated and they had the booster.
Amen. That's a spiritual message. That's a very good message. Dr. Ross, back to the physical. What's the overall vaccination rate in California, in this region, by ethnicity in this region, and by age in this region, if you're able to give us that information?
So I don't have all the data. I'm sorry, thank you. I don't have all of the data. Overall, the vaccination rate of people, overall in the state of California, about 82% of the population has received at least one shot. And about 71% has received both shots. And that's as of March of this year. That's the same for San Bernardino County and for Riverside County overall. When you look at ethnicity, about 84% of Asians have been vaccinated at least one dose, 64% of Hispanics, 62% of the white population, and 57% of the African American population. And of course, in some pockets, it's much lower than that.
That is why we're here today, to up that vaccination rate in the African American community here in San Bernardino and any other place that people are listening. Dr. Ross, is there a difference in the level of protection from COVID-19 as it relates to having both vaccines and a booster versus, versus one dose of the vaccine?
There is. So again, we don't know the full details, and we can rest assured that we'll learn more about this virus as time goes forward. But what we do know is that soon after getting a vaccination, your antibody levels are high, and over time those antibody levels begin to diminish. So if you think of the antibodies as your soldiers that are trained and targeted to fight COVID, soon after getting vaccinated, you have a lot of soldiers, or getting infected, you have a lot of soldiers. But over time, your body decides that maybe it doesn't need these soldiers anymore because it's not seeing a whole lot of the virus, and so the number of soldiers begins to decline, or the antibody levels begins to go down. And then if you get another vaccine, of course, your soldier level goes up high again, so you're prepared for battle. And over time, it begins to wane, and then you get a booster. So that kind of keeps your soldier level, so to speak, up. The more vaccines you get and the more boosters that you get. Ultimately, we'll figure out if we need to get a booster every year or a new vaccine every year, kind of like we do with the flu shot. But in the meantime, getting a basic, starting with the basics and getting your initial vaccines, your second dose, and your booster is important.
Very good. And I understand, too, there are treatments that are being developed beyond the vaccine. Do you have
Yes,
any
so the
information?
vaccination is designed to help prevent infection. Once you get infected, the treatments available have improved dramatically over the last year and a half or so.
What about long COVID? We're hearing about long COVID. What is your take on that?
I haven't really seen any patients with a long COVID like the rest of you. I've heard about it on the news. Basically, it sounds like people who get COVID and don't recover completely have some kind of attack to their immune system, and they have prolonged symptoms, a lot of fatigue, a lot of weakness, and inability to think clearly and function normally. So that's, and we'll know, we'll be better able to decide which population is more at a higher risk for long COVID and how best to treat it with time.
So we're discussing hesitancy.
Yes.
What are you hearing about that? What are some of the responses that you give to people who are hesitant about taking the vaccine? Your magic speech.
Don't have a magic speech. Wish I did. So basically, I try and reassure patients. I talk to them and admit that I was hesitant at first. I wasn't the first person in line. when the vaccines became available. I kind of waited, and then my colleagues, were getting vaccinated, and then I thought, okay, so she didn't die, so I can go ahead and get vaccinated. And so within a few weeks or so, my husband and I were both vaccinated. And I talk about the importance of acknowledging your fears. I mean, you don't have to, develop this huge paradigm of conspiracy theories, and it's about the government trying to kill you. And all of that, and I kind of talk about that a little bit. It's okay to just say, I'm plain scared. There's nothing wrong with being plain scared. And then talking about, well, is it scarier to, be unprepared and potentially get sick, and the consequences of being sick, and how long it takes to recover, and what that means, and potentially being hospitalized. So.
The attention required by medical professions like yourself has caused some burnout, some responses that are not healthy for the practitioners. Have you heard about that? What's your response to that?
So I have a very good friend of mine who is an emergency medicine doctor, and she's been practicing for about 30 years. I have a cousin who's an emergency medicine doctor, and she's been practicing about 15 years. And yes, burnout is real. And my cousin hasn't been infected, but my friend has. And of course, she's been fully vaccinated and boosted. And so we do get burned out. It is exhausting, emotionally exhausting to see patients dying, and then the overwhelming sense of helplessness that you feel once a person gets to a certain point. And the patient, particularly among people who weren't vaccinated, their sense of despair and frustration with themselves because they didn't act proactively in the beginning. And people coming out with these videos and these personal statements saying, I just want to tell my family and my friends to get vaccinated before it's too late. That takes a huge toll on you day after day, hearing people make those kinds of statements, and recognizing that children are being left orphaned by COVID. They're losing both of their parents, people in their early to mid-40s, and teenagers who are now having to figure out life by themselves because of a fear. Not even, something that could have had such a completely different endpoint. So that burnout is real, yeah.
Dr. Rodriguez, we're here at the schools. We are seeing people, gosh, I can't say it any other way, but kind of go crazy across the country about their children and the various rules, policies with the schools. Can you give us an idea of how it's affected the vaccination rate here with the students? And can you give us an idea of the vaccination rate with the school staff?
Sure. So, I'm very proud to say that, we have parents who really are engaged in our community. And while not all of them agree with vaccination or with testing, et cetera, they have gone about expressing their opinions very respectfully. And so, it's a mix, because we're talking about kids. We're talking about vaccinations for children, when yet they have not yet been approved. And so that's been a big fear for our families. As far as, tracking the number of students who have been vaccinated, we have not done that. It is not a requirement for our students at this time, and therefore we have not been tracking the number of students who have been vaccinated. Now, for our staff, approximately 80% of our staff has been vaccinated. It has been something that has been a requirement for us that has been set forth by the CDPH in the state. And so most of our workforce has been vaccinated. And for those that have chosen not to vaccinate, they were given the opportunity to test weekly to make sure that they were not sick.
Masking a requirement for the students in class?
It has been a requirement for our students throughout this time. I'm glad to say that our board has decided that masks will be optional, highly recommended, but optional. So when our students come back to school on Monday, they will not need to wear a mask.
What are the feelings of parents as they've expressed them to you regarding the vaccine? Is there a heavier load one way or the other, or how do you?
No, I would say it's been pretty balanced as far as parents who are for and parents who are against. But the feelings of our parents that we have been hearing, those who are concerned about the vaccine, has been, not necessarily getting a balanced view of all the information about vaccines. And so that has been, something that our parents have stated. You're providing a lot of information about getting vaccinated. What about the opposite? And so as educators, we need to make sure that we're very balanced in the information that we give and that we're not necessarily sharing our own personal preferences in the work that we do. But our parents have said many a time, and if you watch our board meetings, they don't want government agencies making choices for them as parents. They feel that it's taking away their right to parent. And it's their choice. It's a family choice. And so while we have parents who believe it is their choice, we also have other sets of parents who also feel like I need to get my student vaccinated for a variety of reasons. So it has been very balanced. We have been following the guidelines of CDPH and our area public health agencies, but it's been mixed.
I would imagine that the the students are hearing attitudes, policies of a variety of directions, and if I'm confused, I imagine many of them are really confused. Are you seeing any effects of that confusion in their psyche, in their conduct, or are they pretty much soldiering this thing out?
I think our kids are resilient, and while we've seen challenges with absenteeism, we've seen higher rates of suspensions, and just kind of interactions. We haven't necessarily seen major issues with students wearing masks or not wanting to wear them. Now, only recently, I would say within the last month or so, when things have gotten better, there have been concerns about, well, why should I wear a mask when public officials are not wearing masks? But that has been more of, a recent development. As we're looking at how our students are responding, our parents are mentioning that our students are having difficulty assessing body language, affect, because they're not able to read the facial expressions. And so especially for our little ones, it has been challenging. But I think, as we work to get through the pandemic and we are able to meet more needs, hopefully we'll be able to bridge gaps for our students as they are coming through the pandemic. But I think overall, our kids are getting through it. We have seen an uptick of students who are having issues with mental health. We have seen concerns with depression. And so working with our families and working with our students to provide them those resources has been something that we've been really working hard to do.
So you are providing special services for some of the children because of their response to the COVID? So
not necessarily special services, expanding services. So in the past, when we're looking at, as we're dealing with the health emergency, we know that we need to provide additional services to be able to help our students as they get through it. So what does that look like? That looks like adding additional nurses to our staffs, providing more opportunities for students to interact with medical professionals. And then in addition to that, partnering and providing more resources around mental health.
Go back to the question about staff. Is the staff required to be vaccinated?
So our staff does have the opportunity, should they choose not to get vaccinated, to get tested on a weekly basis.
Okay. There are some questions I would like to ask each of you. What are some of the reported side effects of taking the vaccine, Dr. Ross?
That's a great question. And before I actually start talking about that, I do want to add one thing that I didn't mention previously, and that is I am seeing a lot more postpartum depression now than I've seen before. So pregnant women feel isolated. because they don't have baby showers like they did in the past. Everybody doesn't get to come over and see the newborn. And they're not able to go out a lot. So I am seeing a lot more postpartum depression in women who are deciding to not breastfeed because they feel overwhelmed, and are also deciding to take antidepressants. So some of the most common side effects of taking the vaccine that I've seen are fatigue. Usually it lasts for a limited period of time, so patients just say that they just feel absolutely exhausted. Sometimes a little bit of soreness, of course, in the arm where they got the vaccine. And then a few patients, their symptoms have been even a little bit more extreme. Things like low-grade fever, generalized body aches, but all of that has been self-limited. And I haven't seen it in one patient population more than another. It doesn't seem that elders are more likely to have symptoms after the vaccine, or that people who have underlying medical conditions are more likely to have symptoms. It just seems a little random.
Dr. Ross, has anyone indicated to you that they've had bad effects from the vaccine?
Nothing other than the things that I've mentioned.
Okay. And Dr. Rodriguez?
You know, as we're not medical professionals,
So we get to hear rumors and,
Yeah.
that I feel bad, I feel good. So anybody
yeah, I
approaching you with
think,
that?
I mean, from what I've heard people feeling very tired, soreness in the arm. No, I haven't heard that.
And I haven't seen it as an obstetrician either.
And,
I've heard it in the news literature. The studies that have been done looking to see if they could document it haven't supported that idea. And
I'm sorry, we can't hear you very well. If you'll write your question down or come down here with me so I could hear you, that'd be a lot better. Pastor Beckley, have you had anyone speak about bad effects of the vaccine?
Doctor had already mentioned, my own personal experience has been just with both the first vaccine, no symptoms whatsoever. The second one, soreness in the arm, and with the booster, soreness in the arm. But most I've heard is what the doctor has indicated. Some folks were fatigued, some had maybe a slight headaches, maybe that kind of thing. But it only lasted 24, 48 hours, not even 3 days, and then after that they were fine.
Lakers lost the other night. I had a headache. I don't know what that means.
why do you get a headache when the Lakers lose? It hasn't been a good season anyway.
See, that's why we need a good doctor around. Yeah, I'm probably doing okay. She has a question about a miscarriage sequence. I think you were saying that you are
Yes, so as an obstetrician, so there are a couple of different journals that specifically are geared towards obstetricians. And so there was an article that was recently published where they weren't able to document an increase in miscarriage rate. So in general, about 20% of pregnancies end in miscarriage anyway. And that's all pregnancies, all healthy women, about a 20% risk of miscarriage. Now, there does seem to be some disruption in the menstrual cycle for some women who have the vaccine, and we don't completely understand what's causing that. There's been some misinformation in the community about a decrease in fertility rate among people who are vaccinated, and we haven't found any data to support that either. But I'm willing to hear what you have.
I can't find the exact document at this time, but there was a document that was released, 8 pages of adverse reactions.
Yeah, sure.
There were 8 pages of adverse reactions that were just released, thanks to the judge who said they were going to have to release that instead of in 75 years, release it now while we're all still alive and
Right.
before anyone loses a child, because I'm sure you have heard that with children,
I
they die from heart
I'm
attacks.
gonna
That's
interrupt
one of
you.
the side effects from COVID.
Ma'am, I'm going to interrupt you because I was lucky enough to attend San Jose State School of Journalism. And one of the things that we really need to be able to do, especially as we're talking about something this critical, is to be able to document not only that there is a study, but that the study was done by people qualified to do it.
It's
Oh, and-
5.3.6 cumulative analysis post-automation adverse event reports of PF 07302048 received through February 28th of 2021.
That
Okay,
mean?
and so where was it published?
It's a Pfizer document that was just released.
Okay, so yeah, I'll have to look for it. So I can say that, when you say that children are having heart attacks, so there was some information that shows that some, not necessarily children, I mean, at my age, anybody under 40, I guess, is a child, but looking at young adults, there seems to be an increased risk of myocarditis, which is not quite the same thing as a heart attack. That means that there's inflammation of the heart and the pericardium, or the tissue around the heart. It usually presents with some mild chest pain and shortness of breath, and it resolves spontaneously. So a friend of mine has a daughter that had that myocarditis, and she did well. So that's what I know. So I don't know anything about increased rates of heart attacks in babies that are children who are vaccinated. I had both of my children vaccinated. They're 11 and 13. And one of my daughter, unfortunately, had the flu shot in one arm and the COVID shot in another arm on the same day, because her mom's a doctor, and I told her she would be fine, and she was. And then my son, who's 11, got both vaccines, and he had no side effects at all.
Well, we're not saying, from what I've heard, that the vaccine is perfect. I think one of the issues as a journalist was the naming of it as a vaccine, because most of us figure vaccine means it's over, whereas it's kind of like a traffic report. It can tell you what's going on right now, but it doesn't say what's going to be happening in the future.
Right.
And like a traffic report, we tend to keep listening because we know that the changes are going to be taking place, and that we cannot stand on the information that has just been delivered as the full flow of information.
Now, one of the things that I do tell my patients is I compare it to birth control. So how many women die every year as a complication from taking birth control pills? You know, it's real. Some women get blood clots in their legs, or they have a tumor that develops in their liver, and they take birth control pills all day, every day anyway. So everything we do in life comes with a risk, and we have the opportunity to decide how much risk we're going to accept. Or women who don't take birth control and then opt to get pregnant. I have a patient now who's 310 pounds. This is going to be her third cesarean section. And when I asked her if she wanted to have her tubes tied, she says that she doesn't want to do unnecessary things to her body. So getting pregnant again, from my perspective, was an unnecessary risk for somebody who's over 300 pounds. So again, I think taking all of the information in perspective is the way to handle it.
And we're all free
Yeah.
to do what we want to do. As parents, we know that our children automatically revolt with the music, with the clothes, with everything else that they do. And certainly when we give them advice about science, despite the airplanes that they fly in, despite the cars that they drive in,
Or the
despite
motorbikes that they
scientific stuff that we depend on every day and have no idea how that phone works. There is plenty of room for people, I suppose, to doubt and to do what they want to do. I don't know, it's kind of like the intersections of life. As we pass those intersections, we like to be able to have an idea of what other people are going to do, so we set standards with the red lights and the green lights. I have not been able to convince all of my friends and family to take the vaccine. I am not going to blow my family up as a result of that. I am with vaccination and booster and looking forward to the fourth one if they bring it. But at the same time, my age, my view is different, and I do have to leave room for those folks who don't agree with me. And I suppose this is something that we all have to do. I'd like to give each of you a moment for a final word. Hold on. Did you have some other point that you would like to make?
No, you were just telling me to hold on, so I have it, and it's documented, and they're counted. And we had actually a parent who called in and said his son died from having the COVID shot. So there are cases where the COVID shot is killing children. And
Yeah, no.
there's no other vaccine when one of the reactions is death.
I am not familiar with the data. I can't discount the data, but I'd have to see the information to know for sure that that was the cause. So one of the things that I didn't mention is that I did a genetics fellowship when I was at Johns Hopkins. And so I was very familiar with women who felt like the routine standard vaccines that we offer children all the time had caused her child to have this genetic disorder, which of course the vaccine didn't cause the genetic disorder. That's just not how science works. And so there is a lot of misinformation. And soon we'll see, so time will tell. Thank
Time
you.
is telling us now that the bulk of the people who are dying from the COVID are people who have not been vaccinated. I don't know how that sounds to people who are still denying the effectiveness of the vaccine. I do know that it's going to continue to cause families to have funerals that they would not have had people taken the vaccine. But that's not to say that taking the vaccine is going to make you super smart, super rich, or any of those things, but it does seem to give you an edge on life. I want to thank our supporters tonight, which include, let me do this correctly, CAAASA, let's read this correctly, the California Association of African American Superintendents and Administrators, the San Bernardino Unified School District, the California Department of Public Health, and the All Vaccinate 58 campaign. Once again, I'm Wallace Allen. Thank you for the opportunity to be with you tonight, and I hope some of the things that we've said will help save some lives by informing people of the truth about both Tuskegee and the Tuskegee relationship to trusting the government and your ability to trust science like you do those airplanes that you get on. Thank you very much. See you again.